In this morning's Health Watch, bartering for health care. With the tough economy and high unemployment, more Americans are finding medical treatment impossible to afford.
52 million Americans are now uninsured. 49 million say they didn't go to a doctor last year simply because of the cost. But one medical center in Maine is offering a different solution, which is in many ways an old-fashioned payment plan.
The Lucid stage is getting a little sprucing, courtesy of Deborah Barth. She'll spend at least an hour cleaning the theater, time she'll eventually trade for medical care.
I never imagined that I would be going to the doctor and paying them by raking leaves at someone else's house.
Hi, can I help you? Hi, I'm here to see Dr. Knight.
For nearly a decade, True North Medical Center in Falmouth, Maine has been offering its patients the option of paying with their time. Part of its goal to make care accessible to everyone. For each hour of service patients offer to the community, like Deborah's afternoon cleaning, they earn an hour time credit, which they bank with the Hour Exchange Portland. Members of the exchange then use those hours to barter for different services in the community.
I'm just going to reach around here.
At True North, 2 time credit hours equal 1 doctor visit.
You're shrinking. So
it's really a brilliant concept. Besides just being able to get care, using time credits actually helps our patients to see themselves differently, to see themselves as human beings with valued and valuable skills and services to offer.
Pleasure to see you again.
Good to see you, Dr. Knight.
It's an empowerment model versus feeling ashamed. It's not just me going to the hospital and saying, I can't afford to pay, I need free care.
Is there any warning that you get at all that it's going to happen?
I do.
Doctors and patients don't directly barter. Both must belong to the exchange.
How frequently now are you getting the stomach pain?
It's up to the physicians how they use the time credits they receive as payment.
I've had people come in and fix my radiators in my house and have had some house cleaning work done and things of that nature. So it's kind of a different way of getting paid for my services.
You're creating a community where people believe time is just as valuable as cash.
While the community building is undeniable, it's not the only benefit. Both doctors and patients say the accessibility is good for their health.
I find when patients are somewhat invested in their health care, they tend to respond better.
I would have just stopped going to the doctor. I would have stopped seeking care even though I may have needed it because financially it became more and more of a burden.
Today, Deborah Barth says she's healthier, and in many ways, so is her community.
The exchanges that I've made with people, no matter what they are, if it's raking leaves or helping organizers, there's this feeling of camaraderie afterwards.
When the folks started True North, they decided that any practitioner who worked with them, they would have to agree that 10% of the patients could pay, either get a reduced rate or they could pay alternatively with something like the system that they use with the Hour Exchange Portland. So they don't, and we should point out, they don't barter specifically with a doctor. And that's why it works. They put this in a time bank and then they sort of pull it out.
And you hear things like that, it drives the point home where she just said at the end of the piece there, it got to the point where I would just stop going for care.
Yeah.
And to think about that, that's tough for a lot of people.